Alzheimer's should be a rare disease.
We now understand that Alzheimer's is a preventable disease in the first place.
You are not stuck with the brain you have. You can make your brain better.
Hello, I'm Peggy Sarlin, and today I'm speaking with Dr. Michael Breus, the sleep doctor in Manhattan Beach, California. Dr. Breus is going to tell us how you can improve your memory by improving your sleep. Dr. Breus is a nationally recognized expert on sleep. He's appeared many times on Dr. Oz and Oprah and The View and in best-selling books on sleep. So, welcome, Dr. Breus.
Thanks for having me, Peggy. I'm super excited to be here. I think this is a really important topic, and I'm ready to just dive right in.
So let me ask you, you have developed a completely new approach to maximize mental energy by working with your body's natural rhythms to get a good night's sleep. So tell us about that.
That's correct. So my theory is called the power of when. So most of the time when you're thinking about how to help yourself have more energy, you're learning about what to do or how to do it, but nobody's ever telling you when to do it. So if you remember, everybody's got an internal biological clock called their circadian rhythm, and it turns out that there's 3 or 4 different circadian rhythms out there. Once you know what that circadian rhythm is, you can actually figure out the exact right time of day to do whatever it is you want to do, whether it's read a book, get new information, have a cup of coffee, go for a run, have some mental clarity, be creative, sell, buy, whatever it is that you want to do. There are actually specific times in your biological rhythm where you're better at it, and I've figured out a way to identify that.
That sounds completely new, so I want to try to understand this. So the first thing, help me understand, are you saying that each person is born with an innate circadian rhythm the same way that we have a blood type, innate blood type? Is that an analogy?
So, yes, that's a great analogy, except here's one of the things, is so we're all genetically predisposed to have a particular circadian rhythm once we reach adulthood. But that circadian rhythm shifts around quite a bit when we're younger. So when we have babies, babies have much longer sleep cycles. Then when you get to adolescence, they have a tendency to stay up late and sleep late. But once we sort of hit the 18, 19, 20-year-old stage, our circadian rhythm is pretty much locked and loaded until we hit kind of our senior stages where it has a tendency to dial back. We want to go to bed earlier and wake up earlier. Once we know which one of those age ranges you're in, we can actually section that off to learn, could you be a little bit ahead or a little bit behind? So many people have heard of something called an early bird, right? Or a night owl. So once you know if you're an early bird, a night owl, something in between, or somebody who's not such a great sleeper, once you figured that part out, that's when you can dial it in and know exactly what time of day things are working. But it is a lot like a blood type. It just happens to change a little bit until you get to be an adult.
So let's talk about seniors because we want
Sure.
to talk about improving memory. And so once you get to be a senior, you may have senior moments and you
Sure.
may have brain fog and just not feel so sharp. So does that mean that your circadian rhythm has changed or help us understand?
Sure. So it's interesting. So as we get older, our circadian rhythm has a tendency to go backwards. So we want to go to bed earlier and wake up earlier, which means that there are certain times of the day that it's better for us to have information than others. So as an example, if you're going to read a book and your circadian rhythm is early as you get older, when's the best time to potentially read a book? Well, it turns out that in the earlier part of the morning is probably the best time for several reasons. Number one, the level of melatonin, which remember is that key that starts the engine for sleep, is off. So you don't have melatonin that's making you feel that brain fogginess, which by the way is one of the reasons why you do. Number two is you hopefully by that point have had some input as far as energy is concerned, right? So a little bit of nutrition, get the brain going, but you haven't gotten to the point where you've exhausted that resource or that nutrition. So as an example, if you're waking up at 5:30, 6 o'clock, when should you read a book? You should probably start reading a book or an article or a newspaper, something like that, within 90 to 120 minutes of waking up. So somewhere between an hour and a half and 2 hours of waking up is going to be your prime time to receive new information.
So let's just stop there. So by reading a book, I might read a book to relax and fall asleep.
Sure.
By reading a book, you mean this is the time when your brain is most receptive to processing new information.
Yes, that's a perfect way to think about it.
Okay.
Absolutely.
So I've woken up early and naturally, I've woken up, the sunlight has woken me up.
Right.
Because I'm older now and I'm, okay.
Absolutely.
And now what do I do? Now, when's my best time to eat?
So the first thing you do when you wake up early is you hydrate. Okay, so you want to drink either a glass or a bottle of water as quickly as you can. Why? Because remember, during your sleep, you've actually breathed out almost a liter of fluid. So we don't want you to get dehydrated. Also, if you're on medication, there are certain medications that can give you a dry mouth, things like that. So go ahead and hydrate first. Second thing you want to do is if the sun is up yet, go outside and get some sunlight. We know that direct sunlight helps turn off that melatonin pump and resets that circadian clock. So you do those two things at first. Then you have your nutrition. Personally, I like to do a shake or some kind of smoothie or something like that. That way I can get in a good amount of protein early in the morning because that you want to start your day off with that kind of fuel in your tank. You need to be careful. You don't want to have a whole lot of carbohydrates in the morning. Turns out carbohydrates make you feel sleepy because they elevate levels of serotonin. We want actually protein in your system because that's going to get you going. Once you've done those three things, right? Hydration, sunlight, and nutrition, that's the time that you're going to want to go and get some new information.
And use your brain. And when we're talking about sunlight, we may also be talking about exercise. For instance, we're talking
That's a
about
great point.
taking a walk.
Absolutely.
10 minutes in the morning.
Yeah, even walk the family dog, go down to the mailbox, whatever it is, just walk around the block a couple of times. Absolutely going to be a good idea. Now, when you're looking at information, though, and you're trying to do an analysis, whether it's pay your bills or learn something new or write a letter, those types of things, that's one kind of information. But there's also a different kind of information that sometimes people are looking at, and that's more creative. So what's a good time to be creative? The opposite, believe it or not. It's better for people to be creative in the later afternoon when you're a little bit more tired because your analytical side is now starting to shut down, but your creative side is starting to kick in. So as an example, if you like to paint or an artist or a poet or whatever it is that you like to do, that's a great time in sort of the middle afternoon. Try to avoid the middle afternoon nap if you can. And that would be a perfect time to be really creative.
Let's go back to this concept of taking a walk in the morning and exposing your eyes to morning light. Is there something about the quality of the light itself in the morning as opposed to the light at dusk that is going to work with your body?
So natural light is natural light. So you'll get the specific wavelength, 460 nanometers of light. That's the blue light that's in the light spectrum that has the ability to turn off that melatonin pump and help give you energy. So it doesn't necessarily matter the morning light versus the evening light. What matters is the timing of the light. So getting that light in the morning helps reset that circadian clock, and that's going to be one of the big things. A lot of patients turn to me and they say, I feel like I've got brain fog, right? And they feel like, oh my gosh, something's going on with me. What's happening here? A lot of times what that is you're waking up not with your circadian rhythm. So as an example, I have a lot of patients who say, well, I don't want to get up at 5:30 in the morning. Even though my brain wakes me up and I wake up, I'm just going to lie there and kind of hit the snooze button or doze in and doze out. It turns out that's not the best idea because what that ends up doing is you're basically telling your brain it's okay to continue to produce melatonin, and it does. And then when you really have to wake up, you feel tired and sluggish and you don't really kind of have that level of energy that you're looking for. So it's about consistency and it's about listening to your body.
So let's go back to the patient who wakes up at 5:30.
Okay.
If they wake up, should they get up? Is that it? Is you're
Absolutely.
telling us once you're up, you're up?
What I'm telling you is once you've gotten amount of sleep and you have a consistent wake-up time, respect the consistent wake-up time, right? And so a lot of people who might be watching could be retired or not have a full-time position that they have to wake up to every morning. What I suggest to people is pick a wake-up time, just like you pick a bedtime, and stick to it. The more consistent you are, the better you're going to be able to perform and the better my system will actually work. So if you wake up at the same time and go to bed at the same time, your circadian rhythm, you'll know what it is because your body will shift one way or another and allow you to do that. Once you've figured that part out, then you can go to the specific activities like going for a walk in the morning, which I do recommend.
So let's go back to that 5:30 in the morning.
Yep.
Let's say I have set to myself, okay, I'm going to go to bed at 10 o'clock every day, and I'm going to wake up at 6 o'clock every
Okay.
day. Now I'm waking up at 5 or 5:30. So
If you wake up
what
at
should I
5,
do?
if you wake up at 5:30, your brain is done. You don't need any more sleep. Go ahead and get up.
That's it?
Absolutely.
Yeah, okay, 3 in the morning?
3 in the morning is a little bit different. So 3 in the morning, you have to look at what time you went to sleep, and also it doesn't make a whole lot of sense to wake up at 3 in the morning. What I find with a lot of my patients who wake up at 3 is they went to bed at 8,
Oh.
so they're really getting 7 hours.
But they
of
may
sleep.
you're talking about older people, they may need to go to the bathroom.
They may wake up to go to the bathroom. That's certainly one of the things that happen. What I find with some of my seniors is that their day is over by 7:30, 8 o'clock. They're bored. There's not anything else for them to do, and so they end up in the bedroom, they watch a little television, and then they fall asleep. So they actually perpetuate the issue by not staying up. I used to have this treatment I called the Jay Leno treatment. So I would tell them, stay up and watch Jay Leno's monologue.
They'd
and
have to stay up a long time now.
now because he's not on anymore. I know. But maybe it's the Jimmy Fallon. I don't know. But if you stay up a little bit later, believe it or not, I know that sounds very counterintuitive, but if they stay up a little bit later, you'll actually sleep a little bit better.
Okay, so take us through our goal now is that you're telling us when we should be doing you're structuring our day
Absolutely.
for maximum mental efficiency.
Exactly.
So take us through. Now we've woken up, we've hydrated, we've had a nice
Hydrated.
glass of water.
Right. We've gotten some sunlight. We've gotten our nutrition. Hopefully with
We've
the
had some
sunlight.
protein.
We've had some protein. Hopefully with our sunlight, we might have gotten even a little bit of exercise. So now what do we do? So there's a lot of different activities that you can do in the morning, especially because that's probably going to be your most clear time. So that's when I would say that you want to have activities that are going to require a lot of detail work. So whether it's paying bills or writing letters or doing research or reading for a purpose, not reading for pleasure per se, but reading for a purpose.
We're talking about focus. I mean,
Exactly.
let's talk about what are the mental characteristics. There's focus, there's processing, there's
Right.
speed. I mean, take us through some of the different aspects
Sure.
of getting stuff done.
So when you look at something like focus, right? Focus is one of those things that's actually going to happen early in your circadian cycle, whereas creativity is going to happen later in your circadian cycle. That has to do with hormones. So what happens is when you wake up in the morning, your cortisol level is at its highest point because that's what helps you wake up, and then it slowly starts to drift throughout the day, right? Melatonin is lowest in the morning, and it slowly starts to gain during the day. So when those two cross is when you hop over to the other side, and that's when you're more creative. It doesn't mean that you can't still do different activities. It just means that you're going to be more relaxed. You're not going to be as focused. You're not going to be as analytical. You're going to be more, I'm going to go with the flow, or I'm going to be more creative, or I'm going to, get more involved in a new activity.
So, how many hours of good focus time does our body naturally give us?
Well, it gives it to us in chunks. So what I would say is it's very difficult to focus for anything longer than about 45 to 55 minutes without taking a break. Because your eyes get tired, your brain gets tired, there's fatigue that sets in, and this is all assuming normal, healthy adult, as opposed to maybe somebody out there who's got high blood pressure or who may have a cognitive dysfunction or something like that, because that can disrupt things quite a bit. But I would say you've got 45 to 50 minutes of heavy focus, then rehydrate.
Rehydrate.
I'm a big hydration guy, but I promise you it really works. Walk outside, get a little bit more sunlight.
Outside some more. Okay, so we want to
Absolutely.
keep it's almost like nourishment.
It is. There's no question. The human form thrives with sunlight. A lot of times we're locking ourselves into offices all day and we're getting artificial light, and there's nothing better for you than natural sunlight. Now, of course, if it's winter and you're in New York City, it might not be so easy to walk outside during the wintertime, but then just move your chair over to a window to be able to get some of that sunlight, or open a window for a brief period of time. It's also air quality turns out to be a big thing as well. When you're cooped up inside and the heat is running on and on, you're not getting really good fresh air. That's also going to be a real big help for you as well.
This is like our grandparents' wisdom. Go outside and get some fresh air.
Yeah, but I mean, it's true.
Working with the body.
The data is really consistent on it. One of the other things I have a lot of people do is just before lunch is I have them do deep breathing exercises. So deep breathing is so many people out there are very shallow breathers, or they're too big a breather, right? So they take in this big volume of air and then they kind of breathe in and breathe out. What you really want is you want a nice, consistent breath that's kind of lasting all day. But a lot of times we forget to breathe. I know that sounds kind of crazy, but it's true. You get so involved and you notice, oh my gosh, I'm not breathing right now. What you really want to do right before lunch is you want to do what's called diaphragmatic breathing. So you want to really breathe in to be able to fill your chest up, right? And then you hold it for a couple, 3 seconds, and then you breathe out. And you really let that come out.
Show us, give us a
you
diaphragmatic.
Go in, 2, 3, 4, hold it, 2, 3, 4, and then out, 2, 3, 4. You would do that about 5 or 10 times. What it does is it recenters you, it refocuses you, it makes you right where you want to be. Like you can even tell a difference in my voice.
Yeah,
after just doing that.
Yeah.
Right? Is it really?
You sound mellow.
Yeah, it really brings you into a good space. Then, of course, you're going to have a good, healthy lunch, depending upon what you want that to be. That's where you can have probably the bulk of your carbohydrates, by the way, is at lunch. Because remember, carbs can make you feel sleepy, but you also are going to need some energy to pull you through the rest of the day, and that protein is probably worn off by lunchtime or so. After you've had a good, nutritious lunch, there's an issue that's going to come up. Between 1 and 3 in the afternoon, most people feel sleepy.
Most people.
They do. And that's actually evolutionary, believe it or not. So if you go into Latin American countries, what do most people do during 1 and 3?
Yeah,
siesta, right? And so there's an evolution there. So what really is going on is your biology, your core body temperature has a small dip between 1 and 3 in the afternoon, and that causes a release of melatonin, which makes you feel sleepy. So if you want to avoid that dip, not take a nap and end up on the couch for 90 minutes, go outside again. Sunlight stops that production of melatonin. Thing I think that's important for people to realize, not just from a circadian standpoint, but from an overall brain health standpoint, is light is medicine. Light has a dramatic effect on you. And then once you understand how light can have an effect on you and your body, you can do a lot of really interesting things with it to allow you to be more alert or to allow you to fall asleep, whatever you choose.
I think most of us don't appreciate that enough, where our lives are very much cooped inside for most of us. And there's all this healing right outside our door that we can access. So you are recommending, you're building cycles into our day of going outside.
Right.
And getting even just a few minutes of fresh air. May not be so easy for people working 9-to-5 jobs and so forth, but
they do get breaks, right?
They do get breaks.
So what I oftentimes am telling people, hey, look, if you've got a break going on, then go outside and just walk around the block. Or if you can't even go outside, but you want to get a little bit of energy, walk up and down the stairs, a couple of times. Just get the blood flowing. It turns out that sitting for too long ain't good.
Sitting for too long is not good. And of course, we're sitting at our desk all day, most of us.
Exactly.
So there you go.
And so it's really about movement. The second big point, aside from that light is medicine, is movement is medicine. So when you look at Tai Chi, as an example, it's not like they're exercising, but the sheer movement and flow of the body actually helps with circulation. And circulation is your friend because circulation moves resources from one part to another. So as your body is consuming resources and needing it, if you don't move, your body doesn't flow. If your body doesn't flow, you don't get the resources that you want. So really, standing up every 50 to 55 minutes, really stretching, breathing, all of these things. And I know they sound basic, but honestly, they're simple to do, and they have a tremendous effect if you do them on a consistent basis.
So when you say breathing, going back to that diaphragmatic breathing that you spoke to us about before, the Tai Chi, quite a few doctors whom I've spoken to have recommended Tai Chi for brain health.
Yeah.
And for seniors in particular, it's gentle. And that's something even you could do at your office desk. I mean,
Exactly.
It's crossing the meridians.
Right.
That's the healing motion.
Exactly. Many people don't really understand Tai Chi, but it's not like you have to be, study it in China for 20 years to be able to do it. That's the good news, right? Is, you have a midline or your meridian, and as you cross the meridian, you open up muscles and you allow those muscles to breathe, if you will. And what you're really doing is you're allowing for better circulation. And so again, the distribution of vitamins, nutrients, minerals, all those things need to get to the places they need to go. And if you're sitting, you're blocking the river, if you will, and you need to get the river flowing.
Well, when you talked about that sleepy time, the sluggish feeling, it seems like you're recommending the perfect solution, which is getting that river flowing. You feel sluggish, get it circulating.
Exactly.
So.
And when people are out there and they're saying, oh my gosh, I'm having a senior moment or I'm having brain fog or something like that, take a look back. Are you well hydrated? Did you sleep well? Have you moved today? Right? Those are 3 things I would ask people to do on a fairly regular basis. And the way you know if you slept well, does your partner say that you snore? Do you wake up feeling refreshed? Has anybody ever seen you stop breathing in your sleep? Those are signs of something called sleep apnea, which affects the quality of that sleep. So you might have slept for 7 hours, but if it wasn't a good 7 hours, you're not going to feel too well, and that's where that brain fog is going to come in.
So if you wake up, you've put in the time, you've been
Yep.
in the bed,
Yep.
but you feel exhausted, a potential explanation is sleep apnea?
Absolutely. You know, remember, sleep is not just a quantity issue, it's a quality issue as well. And I have lots of patients say to me, "Oh, Dr. Breus, I sleep 8 hours, but God, I'm exhausted all day." Well, my question is, are they at 8 good hours?
Well, okay, we'll get to sleep. Let's keep going through the day. So right now we have powered our way through our sluggish period
Exactly.
we've gotten up at our desk, we've stretched, done some exercises, we've had some more water. Let me ask you a question. If you just, suppose I'm feeling forgetful, I can't remember, did I put my glasses here, there, the other? At that moment, it would be a good idea to have some water, to do some deep breathing.
It would be.
To put it into place right then at that moment.
Absolutely. So we know that as you become dehydrated or as you're breathing too shallow, what you're doing is you're depleting your body of those resources that it needs, and that's what's causing the brain fog. In a lot of cases. Now, I'm not suggesting that there aren't other reasons for brain fog. There aren't, neurochemical reasons and all that. But what I'm saying is, from a more holistic approach, when you walk into someplace and you can't find your glasses,
Right.
slow down for a second. Breathe.
Breathe. Diaphragmatic breathing.
Diaphragmatic breathing. Get some water. Relax for a second and allow yourself the time to remember, and you will remember.
The file to download.
Yeah,
or
exactly.
just help it out a little bit.
Exactly.
Okay, so we're now 3 o'clock in the afternoon. We've powered our way through
Right.
our
We don't-
siesta. We didn't
Yep.
need it. Okay, now what do we do?
So in a lot of cases, especially from a senior standpoint, we're really in the last third of your day at that point. So at that point, it's not necessarily a bad idea. If you hadn't had time to exercise in the morning, that might not be a bad time for you to exercise. This is actually your more creative period of time, is after about 3 o'clock in the afternoon, believe it or not. And so what's the time to do that? Brainstorming about new fun things that you want to try, or thinking about family, calling family members, reconnecting in that way. When you're not as analytical but more emotional, more creative, that's a great time to call some family member that you haven't talked to in a little while, or have that discussion with your spouse or something along those lines, because you've got some time to do that. Now, if you're at work, right? And so you're doing whatever it is that your job,
Right.
entails. And then at 5 o'clock-ish, that's probably not a bad time to help you decompress. And if it's not stressful to call a family member or something like that, then that's a good time to do it as well.
And what's going on in our circadian rhythm? What's happening hormonally? Or,
Sure. So when we look at the hormones and the circadian rhythms at this point, and again, we're talking primarily around seniors for this discussion.
Yes.
What's happening is you're going towards the tail end. And so you're going to be probably having dinner probably around 5:30, 6 o'clock. You're going to be then moving into the rest of your evening. And so what do we want to do with the rest of our evening? As we said before, there are a lot of people who have a tendency to just go to bed because they don't have anything left to do. They're just their day is done and they want to be able to wake up at 5, and so they figure they should go to bed at 9. And that might be okay as long as that rhythm is working for
consistent.
you. It's consistent and is working for you. But let's say that you have a cocktail and you're hanging out for dinner, have a glass of wine or a beer or what have you. Is that a bad time at that point to then relax? It's not a bad time to relax, but if you've decided to drink alcohol, be careful. Number one, depending upon what time you take your medication, it can interact with your medications. But number two, alcohol can depress you. It can depress all of your senses, and it can make you feel sleepy earlier than you probably want to. So limit it to 1 glass of wine or 1 beer. You probably don't want to go more than that, because otherwise what ends up happening is, depending upon what time you drink alcohol, it can have a different effect. So there's a reason that it's called happy hour.
Aha.
Right? So when you drink alcohol at a particular time in your circadian rhythm, it's uplifting. When you drink it later on in the evening, it's depressing.
The nightcap.
Exactly.
we don't want the nightcap.
You know, it's interesting when you look at data on nightcaps. If people have a hard time falling asleep, should they have one glass of something and will it affect them? It's probably not the worst idea, I've heard. But at the end of the day, there's a big difference between alcohol-filled sleep and natural sleep. And so I tell people, if you're going to have one drink before you go to bed, give yourself a good hour for your body to digest it.
Okay. So now we're having a nice healthy dinner, but not a huge meal because
Not at all.
we don't want to overeat when we're sleeping.
Yeah, and it really dinner. You know, people say that lunch should be the biggest meal of the day, or breakfast should be the biggest meal of the day. What I would tell you is the biggest thing you need to think about is the size of your dinner. A lot of people don't eat much for breakfast, don't eat much for lunch, and then they have this really big dinner, and it's like a rock in their stomach. And it takes the body a lot to metabolize through that. What you really want to do is you want to have a lunch-sized dinner and a dinner-sized lunch.
Switch.
Exactly.
To work with your circadian rhythm.
Yeah.
Because then your body doesn't have so much work to do at
Exactly.
night to digest this heavy load in
Right.
there.
Absolutely.
Okay.
See, you get it.
I get it. So we're past dinner time. Now we've got evening. And what would be good? Social activities, playing cards with
Absolutely.
friends?
Playing cards with friends, going to the movies, talking on the telephone. Watching TV isn't a horrible activity. It only gets bad if that's all you do, right? If you're watching television for 4 or 5 hours in an evening, that's probably not the best idea for you to be doing that. I like, especially my senior patients, to do something that's got a little bit of an intellectual side to it. So whether it's Sudoku or crossword or find the word puzzles or having that conversation, playing cards, playing a game, whatever it is, just to keep a little bit more mental stimulation going. I like that idea for people in the later afternoon because number one, it helps give you something to do as opposed to falling asleep. It's stimulating, but not so stimulating that it's going to keep you awake. Like you don't want to play poker for a lot of money late at night, because then you're worried about the money. But if you're hanging out with your friends playing bridge, there's nothing wrong with that.
That's really good. Well, speaking of hanging out with friends, I mean, we know that that's absolutely one of the best things you can do for your brain is to have social interactions, to not isolate yourself,
Right.
and to be involved with other people. So this might be a good time to do these activities.
There's no question. I think it's a perfect time to do those activities. Number one, it takes up that space of time. And then sometimes you can have dinner during those activities, right? So going out with friends for a meal and then going to a movie or going and playing cards at somebody's house where they're serving food or something like that. You just have to be a little bit careful. Remember about the amount of food that you're going to bring on.
And the amount of alcohol.
And the amount of alcohol.
So now we're getting ready for bed. Speaking of getting ready for bed, let's discuss the issues because many people are on their computers or phones or tablets, and this is going to affect they may not realize that what they're doing is affecting their circadian rhythms.
So it is. So we now know that blue light that's emitted either from the television or your mobile device like a phone or a tablet or a laptop actually can have an effect. But I'm the only sleep doctor in the universe that says it's okay to fall asleep with the TV on.
Aha!
And I'll tell you why, okay? Because I have some patients who say they can't turn off their brain at night. And if they watch television, what they do is they don't really watch it, it's on, their eyes are closed, and they're just listening to the television, and it's enough of a distraction from whatever might be stressing them out or bothering them to allow them to then coast off into sleep. 95% of the televisions that are made today have a timer built into the software. If you can figure out how to work it or get your...
That's a tall order.
Right, or get your son or your daughter or your grandchild or whatever to teach you how to use it, you might be surprised at how easy it is to turn that off. What I don't like, though, is when people have a tablet late at night or a phone late at night.
Or they're on their computer.
Yeah, well, because the proximity of the light, it's much closer to your face. Your television is all the way across the room, number one. And then the level of engagement is different. If I'm watching reruns of Seinfeld, to fall asleep to, I'm really not paying a whole lot of attention. But if I'm reading an email from a close friend or I'm playing a game and trying to get my high score or something like that, that level of engagement can have a pretty big effect. I like to do what I call an electronic curfew. So approximately 1 hour, hour and a half before bed, electronics go off. Other than television, if that's what you want to, do. I plug your phone in someplace different, put your computer down. You don't have to check your last email. There's no emergency that's going on.
Not.
Well, if it is, it's certainly not coming to you in an email. And give yourself some time to chill out. The big thing that people forget is that sleep is not an on-off switch. It's more like slowly pulling your foot off the gas and slowly putting your foot on the brake.
Getting yourself in the mood, in the proper
Yeah,
mental
it is.
place
So
to
I came up with
receive it.
exactly. I came up with a technique for people that I call the power down hour.
So take us
Okay.
through your power down hour.
So let's say that your bedtime is 10 o'clock, okay? Then at 9 o'clock is when electronics are gone, because you're going to set your electronic curfew. Then starting at 9, you're going to break that last hour before bed into 3 distinct parts. The first 20 minutes are just things you got to do before the next day. So in our house, we're getting backpacks together for the kids. You know, I might be getting my briefcase out and getting ready for the next day.
Right.
20 minutes. I got to do it in 20 minutes or it's done. 20 minutes for hygiene. Brush your teeth, wash your face, whatever it is. By the way, one of the interesting things that a lot of people forget is if they have really bright lights in their bathroom and then they go in there at night to remove makeup or brush their teeth or things like that, it can actually prevent them from being able to fall asleep. Install a dimmer switch in your bathroom and have dim light while you're doing that. You'll actually fall asleep a lot easier.
Ooh.
The third thing that you want to do is some form of meditation or relaxation for about 20 minutes. You want to do it in bed, preferably with the light off. Because that can be anything from deep breathing, like what we've been talking about, meditation, prayer. If you want to reading scripture or a good fiction book, steer clear of nonfiction books at night. They have a tendency to make you think too much.
Well, how about mysteries? Because you don't want to keep reading to have to stay up to find out who did it.
Well, see, what I like about fiction and mysteries in particular is, when the chapter's done, and you can put your book down and pick it up later. So I think it's okay to read those kind of things. Maybe not a murder mystery or a horror story or something along those lines. And then once you finish through that, you really should be allowing your body to coast right into sleep.
Okay, so now we've set up kind of a sleep hygiene program.
Correct.
Where we have a regular routine in our body. And what's going on inside our body when we do that? I mean, are hormones changing? What is going on internally to make that work for us?
So there's a lot of different hormones in your body that do a lot of different things, but let's talk about two big ones that people have probably heard about and that affect sleep. So one is something called cortisol and the other is called melatonin. So cortisol is the stress hormone. So the more stressed you are, the more cortisol you have, right? And the thing is you don't want high levels of cortisol at night. Because
then you can't sleep.
You're stressed. That's right. And not only are you stressed, but cortisol will linger. It's hard to get cortisol out of your system once a certain level of it has kind of gotten in there, right, from stress. So let's say you're driving home and you get this horrible phone call about some tragedy that's occurred. There goes your cortisol. You're not going to sleep because you can't turn your brain off because your cortisol level is so high, yada, yada, yada. It makes it much more difficult to be there. But the second hormone is melatonin. And that's the one you do want to be high at night. You actually want the opposite to occur in the morning. You want high levels of cortisol in the morning to wake you up and get you going, and low levels of melatonin. So they actually work in what's called a phase response curve. So what we see is in the morning, high level of cortisol, and then throughout the day, we slowly see it dipping, and then getting low right before bed. Opposite is true of melatonin. In the morning, it's at its lowest, and then slowly it increases throughout the day and gets high towards the end. And that's really hormonally what we're looking at.
Well, what you're describing is if we set our bodies up by maintaining these regular schedules and doing things at their optimal time.
Exactly.
We're going to make the melatonin when we need it and make the cortisol when we need it too. Right. And we're not going to need to take melatonin at night. Tell us, melatonin may be the most popular sleep supplement?
It is. It's the most popular sleep supplement. And there's things to think about when you're talking about melatonin. So first of all, what's the correct dose? The correct dose is between 0.5 and 1 milligram. So the 3 milligram, 5 milligram, 10 milligram that you see out there, it's all in an overdosage
I don't think I've ever
format.
seen one that low. Or maybe they're there, but you have to look for them.
They are. You got to look for them. I found them online, and I actually found them at Trader Joe's of all places.
Okay.
So if you got one of those
There
nearby, you might be able to get
Okay.
one. Number 2 is you should take it 90 minutes before bed. It takes that long for plasma concentration levels to reach that level, especially when we talk about seniors who are slower metabolizers. It takes a while for that melatonin to get where you want it to go. Melatonin is not a sleeping pill. It's not a sleep initiator. It's a circadian rhythm regulator. There's a big difference there. But I don't necessarily have a big problem with people taking melatonin as they get into their senior years, because once you hit about 55, 65, you actually start producing less melatonin. Now, don't get me wrong. I'm not telling everybody that is in that age range to run out and start putting themselves on melatonin. But what I am saying is if you find that you're having significant difficulty falling asleep, but primarily staying asleep, melatonin could be a supplement that might be worthwhile for you. Be sure to check with your doctor, because melatonin can interact with certain medications, specifically high blood pressure medications.
Well, okay, I'm glad you raised the topic of medications, because we're talking about seniors,
Sure.
and many of them are on many medications,
Correct.
which may be interacting with each other, and are some
Sure.
of these affecting their quality of sleep?
No question about it. And we should also talk about sleeping pills.
Let's
Right.
talk about sleeping pills.
Yeah, so there's lots of medications out there, and if you read the labels, almost all of them either make you tired or make you not sleep, right?
Not good.
Not good in either direction. So I'm a big less medicine is better kind of person. I'm not saying don't take medicine. I'm not saying be afraid of medicine. Medicine can be extremely helpful, but just speak with your doctor about getting the lowest effective dose. Sleeping pills are a whole different ballgame. There's a lot of people out there who are taking sleeping pills, and there are all kinds.
We're talking about prescription sleeping
We are.
pills.
Well, we can talk about either. We can talk about prescription sleeping pills, or we can talk about over-the-counter sleeping aids that people can.
Let's begin with the prescription ones,
Talk
because
about the
millions of
prescription
people are on them.
They are. It's actually one of the, other than thyroid medication, it's one of the most heavily prescribed classes of medication out there. Turns out there's 3 different classes of sleep medication. There's what are called the non-benzodiazepine hypnotics, Ambien, Lunesta, those types of medications.
Okay.
There are the benzodiazepines, which were originally anxiety medications like Valium or Xanax or Restoril. There's another class of sleeping pills which are actually antidepressants. Trazodone is a big one. Celexa is one that can actually be quite helpful for sleep. And the question becomes, do you really need a sleeping pill? I'm of the belief that not anybody out, well, there are some people out there that may have it, but most people don't have a broken sleeper, right? That
Right.
switch in their head
Right.
that makes them fall asleep. Very few people have that where it's broken. But what's happened is they've had a bad situation, death of a loved one, a health scare, something that's caused a high level of stress, which elevates that cortisol, which makes it hard to sleep. So what do? That stress isn't necessarily going away. It happens for 3 days, 5 days, 10 days. Then they talk to their doctor like, Doc, I'm really not sleeping. So they give them a pill. That pill decreases that stress, makes them fall asleep. Then they associate that with the pill.
It becomes a psychological dependence?
Exactly. And so many of the sleep aids, the Ambiens and Lunestas of the world, there's very little data to suggest that they are physiologically addictive. Nobody's out there jonesing for an Ambien, right? You know, it doesn't have any street value. But psychologically speaking, it's one of the most difficult drugs to get away from a patient.
Now, that's scary, because also taking drugs like Ambien is associated with driving accidents, with increased falls, and,
Correct.
you know, for seniors winding up in the emergency room.
Right. So, and it's really interesting too, is when you look at that data very, very closely, it turns out that a lot of people actually mix alcohol with the sleep aid.
Ooh, that's bad.
So what they'll do is they'll have a glass or 2 of wine with dinner, and then it might be 3 or 4 hours later, and they're not feeling the effects of alcohol, and then they take their nightly sleeping pill. That's when the problems occur.
You know,
More
you
so than
made
not.
a really interesting point. It's a very helpful way to think about that there's not a switch. In other words, you could have a heart, and over time, your heart is wearing out, and there are physical problems in the heart. But you're saying when you're having problems with sleep, there isn't a physical malfunction going on. It's just you're not working, you're not optimizing your body's natural rhythm.
You're doing 2 things. You're not optimizing your body's natural rhythm, which is 100% correct, and that's what the Power of When book is
Power of
about.
When, okay.
But also, the other thing is there's a mental aspect to sleep. 75% of the reason why people either don't fall asleep or stay asleep is either anxiety or depression. Right? So what's going on in your world that's bothering you? That can have a dramatic effect on your sleep. So one of the techniques that I use with a lot of my patients is something called a worry journal. So remember that power down hour I was talking about
Yes,
before? So right before the power down hour starts, if you've got some things on your mind, write them down. Just take a piece of paper, draw a line down the middle, put every problem that you have on one side, and then one solution on the other. Now, the solution, you don't have to solve the problem. The solution might be, I'm going to think about this problem tomorrow at 10 o'clock
Like
when I'm
Scarlett
sharp.
O'Hara. I'll think about it tomorrow.
Right, tomorrow is another day, right? So you want to think about doing it that way, because thinking right before sleep elevates cortisol, elevates autonomic arousal, makes it difficult to sleep. When you go to sleep, you really want to be kind of coasting in to the evening and not be, full of thought. Now, it's easy to say, it's not always so easy to do, but a worry journal is a great way for people to, again, also helps them plan their next day. Oh, you know what, I was thinking about this yesterday, I need to call so-and-so's teacher, I need to call my granddaughter, I need to do whatever I need to do. I've got that scheduled, I don't have to worry about it anymore.
I wrote it down.
Right.
I don't have to worry about remembering it.
Exactly.
Also, when you're talking about depression and anxiety preventing sleep,
Right.
when you've taken us through the day, we've done things that have helped us with that. We've been outside, we've had exposure to
The
vitamin
sunlight.
D,
Yep, big deal.
and we've gotten some exercise,
And some breathing.
some breathing. These are all things that are studies have shown
yeah.
can ameliorate depression and anxiety.
Absolutely. Natural anxiety and depression reducers, all the things that I'm talking about.
So that's one reason you don't sleep well. People may not sleep well is these kind of
Sure.
stresses in their life. And then
Right.
there are the physical aspects of getting older where you might be snoring and have sleep apnea and some of those kinds of issues.
And there's
So-
another one that we haven't even discussed, pain.
Pain.
Right? So
Pain.
pain is a big factor when it comes to sleep, because you might have low back pain, you might have chronic fatigue, you might have some medical ailment that's giving you pain in the middle of the night.
Arthritis.
Or arthritis is another big one, right? So some people, the only time they can actually find relief from their pain is when they lie down, right? Because they're up and around during the day and they've got joint issues or what have you. Some people, if they move wrong in their sleep, it wakes them up, and then they're up, and then they're up for the night, and that can be an issue as well.
So what are we going to do for those people?
So it's kind of interesting, I actually find that with some of those people, some of the PMs, the like Advil PM, the nighttime analgesics, those actually can work quite well for people. Again, talk with your doctor, make sure it doesn't interact with anything, make sure they're okay with it. But for example, I work in a pain center one day a month because people in pain don't sleep. And so I've studied this relationship. And here's what I've learned is you have to treat them both. You have to treat the pain and the sleeplessness at the same time. You can't just treat the pain and hope that the sleep gets better, or give you a sleeping pill and hope that the pain gets better. It doesn't
No.
seem to work. You have to treat them both at the same time. And some of these over-the-counter alternatives can actually be quite helpful. The problem comes is if you take them every night for months and months and months at a time.
Yes, then they start having other effects.
Right, well, they actually stop working. And then people take more, thinking it's going to work more, and then before you know it, you're taking 5, 8, 10 of these a night.
This is not good.
That is not good.
This is not good. Now, also, when you're talking about pain, if you're in pain and you can't sleep, it seems that would bring on anxiety and depression, so that
Exactly.
they would create kind of this.
It's a cycle.
This cycle,
Absolutely.
which isn't good. So we've got pain, and have we talked about snoring, sleep apnea? I mean, these are physical problems, and then people get up and go to the bathroom at night. So those are other things that. How do we address
Absolutely.
all of? Let's begin with so many older people probably
Sure.
develop sleep apnea. Among
They do.
other things, it's correlated with weight
So
gain.
we know that as we get older, our musculature is not as taut as it once was. We're not in as good a shape, right? It's unfortunate, but that's just how it is.
That's the
right?
human body.
Right, and one of the big things that we see is the throat begins to get more and more narrow and close. And we gain weight, which puts pressure on this, so when we lie down, that adipose tissue can push against that already narrow throat. And that's when we see sleep apnea. It's kind of interesting when you look at men versus women for sleep apnea. It's usually 2 men for every 1 woman, but as soon as a woman hits menopause, it's even.
Oh, and what happens to the woman?
She gains weight and her hormones change, and it actually can cause a slight narrowing of the throat and then that added weight. So and it's tough, but if you can keep your weight down, you will be in much better shape from a physical standpoint, but also from a sleep standpoint. But sleep apnea can really have some pretty major effects. And remember, sleep apnea is when you stop breathing at night and your throat actually collapses. So then you either use a breathing machine called a CPAP machine, which helps open up that airway. There are now mouthpieces that people can use that's got an upper and a lower. Bring your jaw forward, open it up. There are surgeries, but I'm not a big fan of surgery.
Yeah, they're difficult.
They're very hard to recover from.
Yeah, they're complicated. So when we've now gone through our whole day, we've gotten up in the morning at the
Yep.
same time. We've hydrated. First thing
Yep.
we had some water, and we've walked outside. We've had sun. Now we're going to sleep at night. What's our rhythm looking like at night? Take us through that successful night of sleep. What is the rhythm?
So we've turned off our electronics an hour before bed. We're in the midst of our power down hour, right? 20 minutes of stuff you just got to do, 20 minutes of hygiene, and then we're now in the final phase of that 20 minutes of some form of relaxation. So that's where I think we get all of the good stuff going on to allow us to coast into sleep in an easier way. Some people do different things. I personally recommend for people the deep breathing or the relaxation. There's some wonderful tapes out there that you can get that do guided imagery, muscle relaxation, things like that. Those are the things. And when you start to look at people's hormones, when they participate in those activities, everything starts to go down, melatonin starts to rise.
In a natural
and that's what
way.
we're looking for.
And then, do we need our REM sleep? What's going to happen actually during the night?
Mother Nature is going to take care of all of that for us,
Okay.
which is great. The only thing that we know that is as seniors, the amplitude or the height of the brain waves begins to shrink. It's just that the brain isn't firing off the brain waves that it used to when we were 13 or 18 or 20 or what have you. You're still getting decent quality sleep. But you definitely need to follow these rules a little bit more strictly the older you get because it's tough. And there's a lot of other factors. The biggest other factor for my senior patients is medication. So if
Yeah.
they're on a medication for some type of a medical
Right.
ailment, we know that there are significant side effects from those.
And that's going to affect the waves of the sleep that they
They
reach?
are.
So they may not get into that deepest, what's the deepest level of sleep? Is
So
that
it depends on how you look at it. I would say the deepest level of sleep is stages 3 and 4 because the brain is the least active during that stage. But believe it or not, during REM sleep, that sleep where your eyes move back and forth
Right.
and you dream, would you believe me if I told you that your brain is almost as active as when you're awake?
Yeah, I would because...
You're dreaming, right? You got all kinds of stuff going on.
Yeah, it looks active.
Right. So a couple of quick tricks that I teach my seniors who are having problems when they're falling asleep. So number one, if your mind is just going, this is going to sound silly, but it really works. Count backwards from 300 by threes.
Whoa.
It's mathematically
hard work.
It's mathematically so complicated you can't think of anything else, and it's so doggone boring. You're out like a light.
Oh,
Works like a charm.
good.
My famous recipe for banana tea.
Banana tea, tell us about banana tea.
So magnesium turns out to be really sleep-inducing, calming the muscles, calming everything down. There's a tremendous amount of magnesium in bananas, but there's 3 times the amount of magnesium in the peel rather than the fruit. So what I have my patients do is wash off the banana, get any dirt or pesticides on it, cut off the tips, cut it in half, leave the peel on and the fruit in it. Put it in about 3 or 4 cups of boiling water and let it boil for about 4 or 5 minutes. Then take the water and put that into your teacup and drink the water. If you like bananas, it's delicious, and it's got so much magnesium, it'll put you out like light.
And so we have that cup of tea at night.
Yeah, you can have it like right before that 20 minutes of meditation relaxation.
Oh, how lovely, a cup of banana tea.
Exactly.
And then
Works out well.
count down from 300.
300,
I'm very busy.
You'll be done.
And any other tips?
Light is a big one. So when you look at the light that's in your bedroom, it's great to install dimmer switches or keep that light at a lower level. Because remember, light stops the production of melatonin, and melatonin is our friend in the evening. It's one of the things that helps us sleep. So you don't want to have your bedroom really well lit. You want to be able to have sort of a dimmer sort of atmosphere. If you like to read before bed, use a book light as opposed to a bedside table lamp. The book light will focus the light exactly where it needs to be. It's not in your eyes, whereas if you have a bedside table lamp, it can have an effect.
Excellent. So we're reading with the book, a fiction book, not a
Fiction book,
nonfiction book. We're
not
drinking
nonfiction.
our banana tea.
Yeah.
And then we're meditating and counting backwards from the 100, and we're gone.
Yep.
7.5 hours later, we wake up, we feel
Exactly.
great.
Yeah, it's that simple.
And we say, thank you, Dr. Breus.
It is that simple, I promise.
Well, thank you so much for coming today and telling us how we can use natural rhythms in our body to protect our brain, basically,
yeah.
over the long haul.
It's great to be able to talk about this type of science with everybody and the techniques be ones that are so easy for people to do. If people want to learn more about my book or what I'm doing, they can come to thepowerofwhen.com.
Thank you, Dr. Breus. And thank you so much for watching, and I hope you learned valuable information about how you can use your body's natural rhythms to enhance your mental energy and protect your brain. Hi, this is Peggy Sarlin at Regain Your Brain's main office. Now, I hope Dr. Breus has put you on your way to solving your sleep problems, if you have any. It's so important to beating dementia and to maintaining your brain health. Now, tomorrow's interview looks at a totally different cause for dementia. If there's a top 10 list for the causes of Alzheimer's, this one has really moved up several notches in just the past couple of years and may even be in the top 3 or 4. I'm talking about mold, believe it or not. Not so much in our food as in the air that we breathe. It is a deadly threat to your health. And you're going to learn about it tomorrow from Dr. Mary Kay Ross. She's the founder and the owner of the Institute for Personalized Medicine in Savannah, Georgia. And she's one of the 1,000 or so doctors who actually trained with Dr. Dale Bredesen in his protocol for treating Alzheimer's. So you'll not only learn about a major cause of Alzheimer's that was really largely overlooked. In this interview, you're going to get a rare chance to hear from a hands-on doctor who sees patients every day and helps them reverse the disease using these new discoveries. And like all the doctors in our series, Dr. Ross takes a functional medicine approach. That means she examines a wide range of factors that can harm a patient's brain. Not only mold, hormone imbalances, sleep disorders, blood sugar infections, and more. And that's why her practice is called the Institute for Personalized Medicine. The doctor looks at the whole person and spends the time to find out what is going on with them. It's not the cookie cutter approach. 5 minutes, here's a prescription, pay on your way out. No, it's not that at all. Dr. Ross got interested in the functional or holistic approach when she got sick herself. A whole bunch of symptoms, respiratory problems, thyroid, autoimmune disease, arthritis. And like many of us, and like virtually all dementia patients, she found out what a poor job conventional medicine does for chronic illness. Now, it turns out it was mold in her home that was making her sick. And further research indicates that mold is the cause, or one of the causes, of about 7 out of 10 dementia cases. Isn't that extraordinary? Now, you won't hear this from your neighborhood doctor. This is brand new, breaking medical news. And Dr. Ross has reversed cases of severe dementia by helping the patient tackle the mold problem. You'll get the scoop tomorrow, so please don't miss it. Check your emails, 9 a.m. Eastern tomorrow for the link to the new interview, and I will see you then.
Please consider supporting our important mission by choosing to own a copy of Regain Your Brain for yourself. You'll receive all the valuable therapies in the interviews and many more additional gifts and benefits. Your purchase will help us continue to bring this vital, important information to more people. Just click on one of the banners below and join us in our mission.